Hey guys, I just wanted to jump on really quickly and share a little bit about my experience of using TXA. I've been on anticoagulants in between Clexane or enoxaparin sodium, also known as Lovenox or Lovenox, and apixaban, also known as Eliquis, for almost 6 years now. During that time, I was losing 1.5 to 2 litres, sometimes more, of blood every menstrual cycle, and nobody was doing anything to help me. Hormones are not an option for me, and basically I had to find something that worked. For the last 5 years, I did my research and I begged and begged and begged everybody to give me a chance and let me try TXA. So TXA is approved by the FDA in America for heavy menstrual bleeding and helping with that. A lot of people don't understand the medication very well, hence the hesitancy of allowing patients with clotting history, clotting disorders, or other risk factors to give it a try. However, I sort of got to the point where I couldn't take this anymore. I couldn't leave my house the entire time that I had my menstrual cycle. I was absolutely miserable. It was starting to affect my mental health and my daily life. And, you just start to feel miserable. So anyway, I advocated rather firmly, and I continued to push for this medication and was finally given it in January of 2024. I was going camping and thankfully they decided to let me try it. Well, I was quite shocked because it worked within about an hour. So I had gone from having worse than postpartum bleeding to nothing. So you take it 3 times a day, 2 tablets 3 times a day for 5 days. And sometimes you can take it for a little bit longer, but I was recommended 5 days only because of my clot history and my clotting disorder. I found it incredible. I had gone from losing so much blood and feeling so miserable within myself to having no issues whatsoever and feeling so much better about day-to-day life. I understand that there are risks, but I think when you weigh up everything, the way I spoke to my specialist about it is when you weigh up everything, the risk of losing that much blood on such a regular basis and for 20 days out of the month, having like a 10-day break and then starting to bleed again is far riskier for me than having my little sort of 5-day period with TXA on board and my anticoagulant. So the super important part here is that you have to take the anticoagulation as prescribed. Like, you cannot miss it. And as long as you continue to do that, you should have a very, very, very low chance of actually having any adverse reaction or a clotting event. Personally, TXA has changed my life and I would highly recommend it to anybody that's struggling. Bring it up with your doctor. However, I say that with a bit of a disclaimer though. It is important to bring it up with a hematologist or a gynecologist who actually will form a multidisciplinary team. It's super important to go to doctors that it's their specialty to help you and understand these things and understand the pharmacology, the pharmacokinetics, and the mechanism of action for these medications. Personally, I know based on the level of training that's provided here within Australia, let's just say, for example, real quick rundown, a doctor can go and become a GP, or also known as a PCP, in 18 months. A specialist studies for 7 years before they can become a consultant. So there's a very different level of understanding and training. And personally, you need to go that level higher and get somebody who actually understands in depth everything. Because it is not a GP or a PCP's, specialty to manage conditions such as this. This is why we have specialists in fields like gynecologists and hematologists who can really allow you to give something a go, and they understand all of the risks, but all of the benefit as well. And that's basically my only other tip for that. But I would highly recommend anybody trying it who is really struggling, because the way that it affected my mental health in such a positive way was so significant. I felt so much better about myself. I wasn't, constantly worrying about having to get up off the couch and thinking, oh, have I just destroyed my couch? Having to sit on towels like some of us have had to do toward the end of our pregnancy in case things, break on our chair and we go into labor. So it gives you that confidence to know that, okay, I can go out today. I'm going to be okay. I am not going to leak everywhere. I don't have to wear incontinence underwear or, disposable maternity diapers, essentially, to be able to leave my house and then be self-conscious, wondering if people can see that through my pants or, whatnot. It just gave me a whole new lease on life. And I wanted to try it out for a few cycles. So obviously we're now in May already. So I've now just completed my 5th cycle on this medication, and I cannot recommend it enough. I have not had any clotting, and I do have a catastrophic clot history where I nearly died. So that has to obviously be taken into account. And I do have factor 5 laden and activated protein C resistance. I do have to have further testing because I also have an autoimmune disorder which they believe is contributing to my issues. And I have a couple of other health issues which are unrelated to clotting. One of them actually is a cerebral spinal fluid leak, which has been recurrent over the last several years. And I have intracranial hypotension, which is low pressure within my brain area and my spinal fluid. And I have a Chiari malformation type 1. So I have to lay flat a lot of the time, and that really sort of disrupts my life as well. But imagine having a period that is super heavy and having to then get up and try and deal with that. It causes a lot of extra pain, duress, and stress. So all round, it has sort of helped extra health conditions as well. So hope you guys enjoy the video, and I really urge anybody who is really struggling to, number one, reach out to somebody you can talk to. Super important. And reach out to your doctor and just see what your options are. There's no harm in asking. Maybe it'll work for you, maybe it won't. But for me, it has been life-changing.